when we added diabetes into the equation, because a person is diabetic, now we are seeing a risk increase from 17.5 all the way to 34.2% risk of having a heart attack. If you have a way of knowing that in 10 years you are most likely going to get a stroke, wouldn't you want to know? Welcome to Dayspring Life and Health. We want to talk about how to predict your 10-year risk of having a heart attack or a stroke or even death. Now, if we use another model, if you go to uptodate.com, these are genuine sites that you could use to just search for Framingham risk model or Framingham cardiac risk assessment, heart attack risk assessment, however you put it in. As long as you type in Framingham, Framingham, you are going to come to this calculator. And this is a similar one that we had from the first one we used. The only difference is that this one has diabetes as part of the risk assessment. So the first one we used, people who are diabetic, they are not asked whether or not they are diabetic. So if you are 40 and you have diabetes, it wasn't accounted for. It means that your risk may even be higher than the 17 that we used. So now let's try this one also. So assuming you are 40, your blood pressure, let's still keep it at 160 for most people who don't control their blood pressure, and your total cholesterol, also assuming you are not controlling it, is over 200. Your HDL, your good cholesterol, which only gets better when you actually eat right and do exercise. I'm assuming that if your total cholesterol is this high, most likely if you are not exercising too, so your HDL should probably be also 35, which is less. And your blood pressure, you're on blood pressure medication, we will do yes. And you smoke cigarettes, we will say yes. We will change the numbers after this, so we will know how the risks change. And then we assume you are also diabetic. Okay, so now let's see, 40-year-old, 160 millimeter mercury for blood pressure on top, at the top number, and total cholesterol 250 above normal, HDL cholesterol 35, which is also very bad, less. It's better when it's over 40. And you are on blood pressure medication, you also smoke cigarettes, and you have diabetes, 40-year-old. Your risk of having a heart attack or stroke, this one is a risk of having a heart attack or stroke. We are assuming that you have never had a heart attack before, but these are assessing your risk of having it in the future. Your risk is 34.2% in 10 years. So 34.2% if you don't do anything about these numbers. If you don't do anything about your blood pressure, which is bad, your total cholesterol, which is high, as well as your good cholesterol, which is bad, and you are a smoker and you take medication for blood pressure, but obviously it's still not controlled, and you have diabetes. So similar numbers, but now when we added diabetes into the equation, because a person is diabetic, now we are seeing a risk increase from 17.5 all the way to 34.2% risk of having a heart attack or stroke by age 50. Okay, so now let's change the numbers slightly. You may say, well, I don't smoke. Okay, so we are going to take smoking out. But we know a lot of 40-year-olds have diabetes, but let's take diabetes out. Hopefully you eat good, you exercise, and your genetics is very good. You don't have any hereditary diabetes and stuff like that. So those are good, but still you are taking, you have blood pressure. You're taking medications for your blood pressure. So when we took the risk of smoking out and diabetes out, the risk decreased from 34.2 to 11.6, which is still high for 10 years. There's a 10% chance that you have a heart attack or a stroke in 10 years. I don't think anybody wants to be in that particular group. So that is still bad. Now, to get it even better, let's decrease the total cholesterol, assuming that you're taking good care of yourself. You go to your annual visit to your doctor and they examine you. The total cholesterol is less than 180, it's less than 200, which is normal. And assuming your blood pressure is controlled, instead of 160, let's do say 130. And then you are taking medications to actually control your blood pressure, so that risk is still there at age 40. And also you do not smoke and you have no diabetes. See, your risk decreases from that high 11 to 4.5%. So about 5% risk of having a heart attack or stroke at this age group. You see how good the numbers are. So 5% chance of having a heart attack or stroke according to the Framingham risk assessment. And actually this is also for a woman. If you can see from here, it's for 10-year risk for a woman. All right, so that is how this works. So I just want to challenge you to mitigate all these risks. So what are the risks? Some of the risks we can do something about it. So your risk of having a heart attack or stroke, age is a risk factor. Unfortunately, everybody has to grow and everybody has that risk. So you can't do anything about age. As you grow, your risk of having a heart attack or stroke increases with age. That is something that has been factored there. So if you put an older person here, if you put 60-year-old there, their risk jumps from 4.5 to 11.5, everything being equal, all the other variables staying the same. Because of age 60, now their risk, instead of being 5%, is doubled. So age is a risk factor that we cannot do anything about. What about the other risk factors? We have systolic blood pressure. The other risk factors, systolic blood pressure, or the top number of your blood pressure. As a matter of fact, blood pressure as a whole is also a risk factor. So if your blood pressure is not controlled and it is high, you have a higher chance of having a stroke or a heart attack within the next 10 years. So, I mean, if you see it that way, maybe you do something about it rather than just to say, oh, I'm fine. So within 10 years, it's a risk factor right there. And your total cholesterol, if you don't know how high your cholesterol is, or if you know your doctor has told you your cholesterol is high and yet you don't want to do anything about it, in 10 years, if you plug your numbers in here with your cholesterol currently, it will tell you whether you'll be around or not. HDL, the good cholesterol, if you are not exercising or eating very good, sources of HDL, you're most likely going to also have a very minimal HDL. And then if you are a cigarette smoker and if you have diabetes, all these risks apart from age are modifiable. In other words, all these risks are things that you have control over. You have control over your blood pressure. You can begin to eat right, exercise, do all the good stuff, and your blood pressure will go down a little bit. I got to caution you that alone at some point, especially with age, would not suffice to bring your blood pressure to normal levels. So at some point, because of age, you may need to have medications to control your blood pressure. So you have control over your blood pressure. That's the point I'm making here. You also have control over your cholesterol. And apart from genetics, eating right may help with your cholesterol. Eating right and obviously exercising may help with your cholesterol. So you have control over cholesterol. Some people will do all that, but still, just like the blood pressure, because of your genetics, you may need to take medications consistently to bring your blood cholesterol to a normal level. And then your HDL, another risk factor that you have control over. You can exercise and do all the good stuff, and your HDL can increase. This is something you have control over. Your good cholesterol, exercising will bring it up. The good thing is when you exercise, not only does that go up, you tend to also reduce the bad cholesterol. So that is again a risk factor that you have control over. Smoking, if you are a cigarette smoker, you may also be able to stop smoking. So you reduce your risk here. Again, you have control over it. Being diabetic, you may not have control over it. Some people do. If your diabetes is not from a hereditary or genetic standpoint, you did not inherit it because anybody in your family has no diabetes, most likely it is something that you have control over, which means you can become non-diabetic. If you lose weight, you eat right, you exercise and focus on it, you may be able to get out being diabetic. There is still ways you can control your diabetes from becoming worse, which is the medications out there you have to take consistently, and also seeing your doctor all the time to ensure that your care is consistent. So we have control over all these risks. 1, 2, 3, 4, 5, 6 risks here that we have control over to reduce our chance of getting a heart attack or stroke or dying early in our lives. Now, if I asked you to do something about your life such that you will be around for the next 10 years, and not just be around, but be there in perfect health, maybe not as perfect as you want it to be, but at least be there healthy enough to do your own thing, go to work and come home and see your family and enjoy your own little fruits of your labor and stuff. If you have control over it, wouldn't you take care of it? I'm pretty sure you would. But most of us, by not seeing our clinicians, by not seeing our doctors, by not picking up our medications, some people do pick up their medications, but they don't take them. By not exercising, by not focusing on eating right, most of us, by not doing those things, are literally telling ourselves that life is not worth it. Within the next 10 years, I'm good with a heart attack, or I'm good with a stroke. That is literally what you are saying. Howbeit, you are saying it lightly. Nobody can hear you. I feel bad saying it that way, but it's sad to see younger people passing away, and older folks who could also be still around just because they neglect taking care of their stuff, like just blood pressure, just eating right, just exercising, just stopping smoking, just taking care of your diabetes, and do all the things that your doctor and your pharmacist recommend you to do. It is sad that people are not doing it, and they are paying the heavier prices, sometimes not just by them, but by their children that they leave behind, by their spouses that they leave behind, or sometimes they live to pay the price because they become incapacitated. They become bedridden because of stroke. They cannot walk or live a normal life anymore because of stroke. Everything is bad for them after the stroke. So if you want to avoid all such things, it is possible. You cannot change anything with age. You have to age. That risk cannot go anywhere. But we have more that we have power over than just age. And I challenge you to begin to do stuff right. And I also want you to yourself go to uptodate.com. It will ask you to subscribe. You don't need to subscribe. This is a healthcare website, but just right there on the site, look for or search for Framingham risk assessment, cardiovascular risk assessment, Framingham cardiovascular risk assessment. And when you get it, you will be able to plug in these numbers yourself if you know your numbers, and be able to change them. And if you also want to go to the other site where we went earlier, which is mdcalc.com, you can also search for Framingham risk score for coronary heart disease. And you can put, the thing I like about this one is you can select whether or not you're female, because being male is also a higher risk factor. Unfortunately, that is what it is. Anyway, thank you for watching, and I hope you begin to take care of yourself. Beloved, I wish above all things that you prosper and be in health, even as your soul prospers.